I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome. I hope you all are safe and warm. It is windy and it's supposed to be like 20 degrees outside in Northern Virginia, but with the wind chill, it feels like -7. We also have a really awesome experience of the Walk for Peace is moving through our area so today and tomorrow. And so it's super cool to just get to see people sharing images, sharing pictures. Um, and for clients that I've worked with that have been able to see it in person, I've just heard amazing things. I personally, yes, I was not able to see the monks in person. I was hoping that they would walk by my office on Route 1, but they took a route down downtown Fredericksburg and they ended up crossing a different bridge. So I was not able to see them. And Friday was just client after client after client. And so I did not get to see them. I don't know that I'll get to see them tomorrow, but it's my understanding that they're planning an event once they get to DC that anyone can register for and maybe watch or stream. But just the Walk for Peace, it seems to come at a perfect time. Wow. Teresa mentioned Walk for Peace is amazing. I was blessed to see it February 1st when they entered Chesterfield County, Virginia. That is super cool. I actually used to live in Chesterfield County back when I worked at Virginia Treatment Center for Children for my pre-doctoral internship. And so that is so cool. Today's topic is talking about Lindsay Clancy. So, Lindsay Clancy, she is a mother of 3 children, and she is charged with so all the trigger warnings but we're not going to go into because this is about the lawsuit against her providers because she was under the care of psychiatric nurse practitioners, psychiatrists. She was under mental health treatment, and during that time, she ended up harming her children, and she also made an attempt for her own life as well. The last time I heard, because I think she like jumped out of a second story window or something. I do believe that she has some possible like paralysis. I don't know if any of that has improved, but the last I saw, I thought she was still paralyzed. And this lawsuit might get into it. So I was able to find the court document where Patrick Clancy, her husband, has filed a malpractice lawsuit against her treatment providers. And then she has also filed a lawsuit against her providers as well. Their lawsuits will likely wait until her criminal trial because she is going to go on trial. Remember, I'm not a lawyer, and the next time I have Josh on, or a lawyer on, I would love to ask a lawyer about what might happen from the malpractice side if she is convicted. So if she was convicted or if she was found not guilty by reason of insanity, could that impact the malpractice case? Either way. We talked about this in Virginia, there was a vice principal that was found liable for a teacher at her school being injured by a student after bringing repeated concerns to administration about that particular student. And the civil case already happened, and now that vice principal, she's going to have her criminal trial. And I wondered like what might happen if, let's say, she was found not guilty in the criminal trial. Could that affect the civil judgment? And it may or may not. The lawyers get to break all of that down a little bit more. And so there are a lot of live streams. I'm seeing people talk about the Walk for Peace. So I follow it on Facebook. If you look up Walk for Peace, they have their live streams going. They also do a talk. So sometimes they do a talk at lunch and they do one in the evening. when they were in Fredericksburg, I think maybe Caroline, because they were a little bit further south, I think in Caroline County. One of the talks they gave was about mindfulness, taking things one thing at a time, which my ADHD brain, I like to do 12 things, but I sometimes need to slow down and just do one thing at a time. And they also talked about not pressuring children to be something particular, to let children be who they're going to be, which I thought was pretty cool. So back to this case. So Patrick Clancy, the husband, he fully supports his wife and he believes that she needs treatment. Okay. And so the complaint starts with Patrick Clancy, uh personal representative for the estates of his deceased children, Cora, Dawson, and Callan. Patrick's wife, Lindsay Clancy, is alleged to have unalived Cora, Dawson, and Callan prior to the alleged incident. And so I'm not gonna read it exactly the way it is because I need to make it YouTube friendly. Lindsay sought medical treatment for her anxiety and increasing poor and deteriorating mental health. As alleged herein, her treatment providers, and they list out the names of her treatment providers. And I believe it's a psychiatrist, a nurse practitioner, and there's a specific mental health clinic and a health system that are all named as defendants, exacerbated her mental health struggles. Indeed, the allegation is that the diverse and powerful medications they misprescribed, coupled with their abject failure to appropriately monitor Lindsay, resulted in Lindsay's mental health deteriorating to the point of thoughts to harm herself and requiring inpatient care. Ultimately, defendants, who are the health providers that they named before, that their negligent treatment of Lindsay, including their complete failure to recognize and address the radical erosion of her mental health, resulted in tragedy, namely allegations that Lindsay took the lives of her children. If defendants had not acted negligently and rather had provided adequate care, it is more than likely that Patrick and Lindsay's children would still be alive today. So it's more likely than not that Patrick and Lindsay's children would still be alive. Okay. And so this was really interesting to me because as a mental health provider, there are times that my client's mental health might start to deteriorate. And I take a very collaborative approach. And now, if my client is telling me that they're having thoughts of harming themselves or harming other people, if it's clear that there's a safety issue, we discuss how that can be managed in the most efficient way possible. And there are some people that I've worked with in the past or cases that I've heard about in general where postpartum or a caretaker that's taking care of multiple very young children, sometimes they might get really extreme thoughts, and that caregiver might get concerned about their safety with those children. And so then myself and the medical team will often recommend that they not be left alone with them until they're more medically stable. So until their mental health is more stable, if they are having those intense thoughts towards themselves or to their children, that there is some type of safety plan in place. And Sarah, thank you for the super chat. Wait, she's not plead. So it's my understanding she's pleading not guilty by reason of insanity. So I that's my understanding of what she is going to plead. That's my understanding. Okay. So that's my understanding. Because I don't think she can just plead not guilty because I think it's pretty clear that she's the one that did the things to that day. Because it's my understanding. So some of the parts that make me a little uncomfortable is that in whatever state Lindsay was in, it's my understanding that the children were harmed while her husband was away from the home. And it was almost as though Lindsay knew that the harm could happen during that time that he was away from the home. I'm going to follow this case. I'm going to watch it. If the state strongly believes that they can prove guilty, they will proceed to trial. And everything I've seen, it does look like the state is continuing to proceed to trial. There was a case in Virginia where they did have an individual harmed somebody else, and the state agreed, yes, this person is not guilty by reason of insanity, and they did not take it to trial. The family of the victim was very disturbed. Like, they were very upset by that, because they wanted a trial. They wanted the state to try to get what they would feel was justice for their family member. But even the state felt that there was a pretty strong not guilty by reason of insanity, and they accepted that plea. And that's how that case, it was either in Virginia or it was in Maryland, one of those two. Okay, so what exactly are they claiming the docs failed to do? Let me get there. Let me get there. And I do have a breakdown of the claims in the description as well. Okay. So they list the different parties and the facts of the case. So they start with the Clancy family. And so in January 2023, Patrick and Lindsay Clancy were living in Massachusetts with their 3 children. They were married in December 16th and settled in the area they were living in. Patrick worked in telecommunications while Lindsay began her career as a nurse. And it's my understanding that she was a labor and delivery nurse and would likely have an understanding of postpartum symptoms. Now, just because somebody understands somebody else's symptoms does not mean that they could treat themselves. But there were some things that, because I saw the lawyer, I want to say Melanie Little. I'm almost positive that's her name. Y'all know me in names. She covered this, and I heard her starting to read parts of this, and so let me see if I get there. And there were some things that were included by the family that could potentially be used against them, I think, down the road. But we'll continue. Lindsay and Patrick had always intended to have children, and soon after getting married, began to grow their family. Their first child, so they were married in 2016. Their first child was born December of 2017. And then their second child in September of 2019. Lindsay experienced some anxiety following the birth of her first 2 children, which worsened as it got closer to her return to work each time. She was able to overcome her anxiety both times through exercise, a healthy diet, meditation, socializing, and following her second child's birth, several therapy sessions. Lindsay and Patrick jumped into parenthood and worked together to provide the best possible environment to raise their children. In order to spend more time at home with her children, Lindsay began working part-time night shifts in the labor and delivery unit. Now, I will tell you, night shifts are difficult. So this is Patrick's claim. So what I am reading now is Patrick Clancy's, let me see, what's this called? This is because they filed, these are the court documents. This is the malpractice lawsuit. So that is what I am reading right now. Okay. All right. You all ask great questions. All right. So working night shift can sometimes mess with your sleep. So just without having children or any of those things, just the fact of working night shift, that can cause a person's circadian rhythm or their body to kind of get out of whack already. These are just my general thoughts as we're talking about this. This is not like, so I'm just talking about what could be happening in this case, and just sharing general information. I thought this was incredibly interesting. Okay. Patrick and Lindsay so we talked about their family. She began working nights. They repeated that part. Okay. And so during her shifts, Lindsay remained attentive to her children and would monitor their baby monitors from work as while they slept. Um, Lindsay's career remained important to her. She remained passionate about nursing, and having a career also allowed her a chance to get out of the house and interact with others. Lindsay became pregnant with the couple's third child several years later, and gave birth to their third child May 26, 2022. Okay. Both Patrick and Lindsay took medical leave following the birth of that child. Patrick's leave was 12 weeks, and Lindsay was scheduled for 18 weeks of leave. The family spent their leave together, visiting extended family, the local beach, the pool. Lindsay repeatedly told Patrick how happy she was, how much she loved their new child. She was also enthusiastic and energetic, returned to exercising, something that had always been important to her. Patrick and Lindsay ran 2 5K road races in July. Ooh, she gave birth in May and was running a 5K in July. Okay. And so the next section of this is Patrick's return to work and Lindsay's impending return to work. Patrick returned to work 12 weeks after the birth of their third child. For the first time, Lindsay was challenged with taking care of their 3 children single-handedly during the weekdays. Lindsay was also faced with her own return to work at the end of September 2022. Previously, the time period leading up to the end of their parental leave had been difficult, which had resulted in an increase in anxiety. Lindsay began to experience stress and anxiety September of 2022 toward the end of her maternity leave. So the interesting thing about this to me is that it seems like the trigger to the mental health was her return to work. So postpartum, because her child was born, I've worked with individuals that are postpartum, and their postpartum symptoms typically start after the birth of their child. Now, I'd have to look at the DSM-5 to see, can postpartum symptoms start that, but it sounds more like a trigger. The trigger might have been the return to work, was that stressor, and then trying to be away from children and trying to navigate all of those things. That's how I'm reading this, taking a look at all these things. I did a prior video talking about postpartum psychosis, postpartum anxiety, and I do have links to those resources in this description. And I also have additional that prior video talking about this case, and also another famous case. I have both of those down in the description. Could this be a maladaptive way to resolve cognitive dissonance? So I don't. So we're just, I don't know. And also return to work is hard. So especially with now trying to juggle the needs of 3 children. The oldest, I believe, might have been transitioning into some type of school environment. That is where some people get additional home help. That they do place their children in daycare, or they do get some type of official help. 18 weeks is, so I got 6 weeks. So, if her hospital offered paid 18 weeks, that is, so I received 6 weeks of leave, and it was I think 40% of my salary, which didn't include my hourly billable, which was because my hourly billable was half of my pay. My salary, so I returned to work after 6 weeks. Thankfully, because of the type of work I did, I was able to come back slowly. And I also had my mom watched our kiddo for 18 months. So for the first 18 months of his life, my mom had him right down the street from the office I was at that time. Yeah, 6 weeks. But I was ready to go back. So everybody feels different about different stages. So the baby stage is my least favorite. So like my favorite stages are more like 4 and up. Those are I really like 4 and up. 3 is, 3 is 3 is tough. Some people love the baby. They love the I now I cherish those times, but I didn't want to stay in the baby times forever because they need you for everything. For so like now, my son, he's downstairs playing with grandma and grandpa. If he was 6 months or 7 months, I wouldn't be up here streaming while because I was able to nurse for the first year, and stopping nursing was like that's when I finally slept. I finally got good sleep. I was sleep deprived for the first year. It was tough. It was really, really tough. Our kiddo did not sleep well until after I stopped nursing. That's when because what would happen is he'd get fussy around like 2 a.m., 3 a.m. And they say don't feed him. Like that's what they say. They're like, don't feed the baby. But he's crying, and I'm just like, I know what'll help him go back to sleep. So I was really bad about that. That was on me. It was. So that's why our sleep was horrible the first year. Once he was weaned and it was like, no more. He started sleeping through the night, and it was glorious. All the details they're providing so far doesn't make I know. So um uh okay, because of her anxiety and impending return to work, Lindsay decided to seek psychiatric care. To address her anxiety, Lindsay sought psychiatric care from Dr. Tufts, Aster, Dr. Tufts, from Aster, which is the name of the practice. Dr. Tufts is a psychiatrist at Aster who, according to Aster's website, specializes in PTSD, trauma related disorders, mood disorders, anxiety, OCD, ADHD, substance, women's health, and perinatal and postpartum psychiatry. Lindsay decided to extend her maternity leave in hopes of improving her mental health. So Lindsay went beyond the 18 months, which was likely, I wonder if she got FMLA. So family and medical leave, because if you have, let's say, a mental health condition that's going on, because sometimes the psychiatrist will agree, yep, mental health wise, you're not ready to return to work, and you can get unpaid job protected leave that extends beyond whatever your paid leave is. That's what I'm saying. That's not what's in here. Okay. Dr. Tufts treated Lindsay from on or about September of 2022 through January of 2023. During that time, Dr. Tufts prescribed Lindsay a variety of different medications. And so the allegation is, but failed to monitor her reactions to those medications or attend to her worsening psychiatric condition. Lindsay's first appointment was on September 15th, 2022. That day, Lindsay was diagnosed with generalized anxiety disorder, chronic adjustment disorder, and with depressed mood. Okay, so adjustment disorder is a common one. So she was diagnosed with generalized anxiety and adjustment disorder with depressed mood. When Lindsay first began treatment, she was hesitant about taking prescribed medications, but she was prescribed sertraline, known as Zoloft. And not everybody does well on SSRIs. So SSRIs are serotonin reuptake inhibitors. What it does is that medication helps the good thoughts, the serotonin, stay in the brain and not get like sucked out. So for some people, because of their body chemistry, the joke on TikTok, not joke, but some people say I get my serotonin in a bottle, and it just helps those happy thoughts stay in a person's brain. Some people don't do well on SSRIs, and one of the in children and teens, SSRIs can trigger thoughts of harming self. That is one of the things, and it can be hard to determine which one came first, because a symptom of depression can be thoughts of self-harm, But there are some people that I've worked with where when they started the medication, all out of nowhere, they started having thoughts to harm themselves and they never had those thoughts. And taking them off of that medication, those thoughts went away. So it was clearly medication induced. Okay. So Lindsay did not initially take the medication, but by October 3rd, Lindsay told Dr. Tufts she was on the verge of taking medication, but wanted to try therapy first. Lindsay began taking the prescribed Zoloft by mid-October, 1 week after starting the medication and increasing the dose as prescribed. But on October 20th, 2022, she reported feeling awful. She was experiencing insomnia due to the medication increase. She was having difficulty with eating, felt more depressed, was crying all day, experiencing mental fog, and was terrified to start something new. So that was worsening anxiety. So most doctors, so if I was the therapist, I would be encouraging my client to talk to the doctor about changing to something else or coming off but doing something about that. Um, Indeed, she explained that her anxiety had gotten worse than before she started taking the medication, and she felt it was difficult to differentiate, like to determine the difference between how she felt before taking the medication. Um, and overnight was experiencing, ah, and was paranoid of getting suicidal thoughts, something that had never happened, and not wanting to be alone. Okay. This reaction to a relatively low dose of the medication was atypical, and according to the lawsuit, should have prompted Dr. Tufts to assess why Lindsay reacted this way. Among other things, she should have conducted testing of plasma levels of the medication. I've never had somebody do that before. I've had clients have negative reactions to medication, and they've never taken a look at the plasma level of their medications. Is there a way to check so serotonin, it's a neurotransmitter. So so serotonin is a neurotransmitter. So I don't remember, I'm not the medical doctor. So um I am not sure, but serotonin, it's a neurotransmitter. Okay. Do we know if she had similar problems with either of the first two children? No. So there was some anxiety. This was worse anxiety. With this third child, it sounds like the anxiety was worse. And then what they are alleging is that the medication made her worse. And I've worked with a lot of people, some people that have had great experience with Zoloft. Okay. So I have about a large percentage of my caseload that has had a good experience with Zoloft. I have a bunch of people that have had a bad experience with Zoloft. There are other medications like Celexa, Prozac. There are a bunch of other medications. What often helps is if you know somebody in your biological family that has tried an antidepressant before, because there are some families where Celexa works for them. There are some families where Zoloft, everybody does poorly on Zoloft. And so that's why sometimes psychiatrists will ask about what medications other people in the family have been prescribed. Are there any medications that people haven't done well with? Or if you're aware of any of those things, sometimes talking about that can be helpful. Okay. Um, all right. And so Lindsay's condition deteriorated during the fall. Among other things, she experienced increasingly bad insomnia, anxiety, and depression. Instead of working to identify the source of Lindsay's condition, they're alleging that the psychiatrist attempted to treat her symptoms by adding medications to treat her anxiety and depression, which, I mean, that's a really common. So with malpractice, it's going to be a lawsuit. But there would have to be a peer doctor that would say that they would handle things completely different. And I do think that she was prescribed some really strong anti-anxiety medications. Um, and so that's where I like to talk about, and some people just don't do well with SSRIs, and they do a different type of medication, like Wellbutrin is a SNRI. Let me see. Sometimes if I say it off the top of my head, I don't get it right. It's a NDRI. So, yes, it is a so it's a different it's a different class of medication. And so some people do so sometimes they'll switch to something different altogether and get out of the potential SSRIs. Yes. Afton, you win. Gold medal for you. We give out imaginary gold stars here. Okay. So then by the end of October into November 2022, Lindsay was still hopeful about the future and about returning to her baseline. For example, on October 31st, 2022, Lindsay reported to her therapist, a colleague of Dr. Tufts, that she was hoping to return to work soon. And so I think they're just trying to say that she had some hope at this point. Okay. By mid November, however, her insomnia had become so bad that she was sleeping only 3 hours per night. Her insomnia became so severe that on November 16th, 2022, she went to the emergency room for treatment. She was prescribed another medication, trazodone. However, it was not effective. So trazodone is a pretty strong trazodone is a really strong sleeping medication. And for you to still have insomnia, even with trazodone, and that's where I don't know, because I like to think about what people could have done different in a situation. There is no magic ball. And so that's where I don't know if doing a psychological evaluation, recommending a sleep study, like was there something happening? Like, is there something getting in the way of the sleep? Because so I know for me, I would experience insomnia once my kiddo got to a certain age because I need to turn the sound on his baby monitor off. So if anytime the baby monitor lit up and he would just be like turning over, like our baby was fine. And me turning the sound off on the baby monitor, if he cried, I could still hear him. So I'm a very light sleeper and my husband was there too. And so and our room is across from his room. And so if he did wake up crying, we would be able to do that. There is genetic testing that it won't pinpoint exactly what medications a person can take, but it can say based on your genetics, these are the medications that we would recommend. Insurance does not always pay for that. So sometimes that is something that people have to pay for out of pocket. Not every psychiatrist is always going to recommend that. And sometimes that's something that people have to advocate for on their own. So there is, and then the efficacy of those tests, some doctors may think but I know I've done genetic testing um just through like the ancestry.com or whatever. And on the health side, it said, I'm not great with lactose, which I knew. It also, so there were certain things that came up in the health side. I did do the 23andMe. I did not join the class action lawsuit for the leaked data. I don't know, if somebody wants to clone me, I guess I don't know, whatever happens with that data, it is where it is. But they had certain health data on the 23 and me as well. Yes, there are definitely tests that they can do. Not every doctor does it. So medicine is considered a practice. And so there can be this, okay, let's try this and let's see how it goes. And the only thing is that I think safety needs to continually be assessed. And what's going to be important in this case is what is in those doctors, nurse practitioner, and mental health professionals, what is in their case notes. What did they follow up? So if there is any indication of thoughts to harm self or others, what was the plan? All of those things need to be written up extremely well, because that is what protects you during a malpractice suit. Yes. So there is genetic testing. Insurance normally doesn't pay for it. So that's why, so I work with a lot of clients that have Medicaid or that can't always pay for things out of pocket, but there is definitely genetic testing for for medications. Is there any indication that she sought help from her PCP for the insomnia? So I think she was going with a psychiatrist. Once you're connected with a psychiatrist, because the psychiatrist is going to have a better understanding of the mental health things. So the PCP probably wouldn't have wanted to touch it because the psychiatrist is prescribing the Zoloft, all of those medications. She did go to the emergency room, and it sounds like the emergency room prescribed trazodone. And where I'm at in the lawsuit, it doesn't sound like that was helpful. So, all right. In an attempt to assist her daughter-in-law, on November 20th, 2022, Patrick's mother, a nurse at South Shore Health, I think that's one of the people they're suing, contacted a specific psychiatric nurse practitioner. And this nurse practitioner worked in the perinatal behavioral health program of South Shore and asked her to reach out to Lindsay. Nurse Paul did so. And Lindsay reported that the trazodone she had been prescribed had not been effective in helping her sleep, even when taking 150 milligram dosage, which I think like that's on the higher end of the dosages of that. Lindsay reported that she was very frustrated and scared and afraid of being on medication long term. She told Nurse Paul that she was feeling very overwhelmed, starting to have racing thoughts, constantly thinking, experiencing insomnia, averaging 3 hours per night, that she was very frustrated and scared. On November 21st, 2022, Nurse Paul prescribed fluoxetine, also known as Prozac. So we're still in the SSRI category. Lindsay was describing symptoms suggesting possible mania, such as racing thoughts, extreme insomnia, frustration, and feeling scared. And I wouldn't necessarily say that would, because sometimes with anxiety, severe anxiety, people can have racing thoughts, but their allegation here is that it could have pointed toward mania or maybe even hypomanic symptoms. At this point, again, lab work should have been performed to ensure that Lindsay was metabolizing the medications she was being prescribed at a normal rate. However, no lab work was done. I've worked with a lot of people that haven't gotten lab work. Now, there are certain medications where you have to do lab work. Medications like Depakote and lithium. So medications for bipolar disorder, you do need to get regular blood draws to check the therapeutic levels of those medications. I haven't known of people to get blood work to see how they're metabolizing the medication. I've been doing this for almost 20, so I guess for more than 20 years now. Now it is helpful. So when people are about to be hospitalized, so let's say I refer them to the ER, and they're on their medications, the ER will often take a blood draw and check levels. They're often also looking for making sure somebody hasn't taken too much of a medication or that they don't have illegal drugs in their system as well. 2 days later, Lindsay reported to Nurse Paul that she was feeling disconnected and out of it, feeling a bit spacey. This happened a few times in the last couple of months. Shortly afterwards, on November 25th, 2022, Nurse Paul prescribed Lindsay 3 different medications: Ambien, Remeron, and Klonopin. So those are very, very strong. Let me look up Remeron. I know I've had people on that one before. Okay, so Remeron is an NASSA. Let's see. That is medication. Oh gosh. All right. I'm gonna have to put this in the chat because where my brain is today, I don't know that I can say this word. All right. So Remeron is a noradrenergic, and specific serotonergic antidepressant. So NASSA. And it can be prescribed for it can be prescribed for major depression, insomnia, but prescribing all three of those things at one time. So if I was working with a client and all of a sudden their psychiatrist completely changed up their medications and added three new things, and my client starts to have a lot of negative symptoms, I would reach out to the psychiatrist, or we would try to see, because sometimes you make changes one at a time. But she's saying she's getting increasingly worse. And I think at this point, they're just desperate to get her some sleep. So that's a lot of medications all at once. You would normally do that on an inpatient basis. I've never had somebody do that on an outpatient basis from home. Me personally. Remember, I'm not a psychiatrist, but I work with people that are on medications, and as a therapist, to make that many changes and my client is deteriorating, because we would want to change one thing at a time just in case the Remeron causes an issue. Like we know like what's doing what, and not all of those other things. Okay. But that's what happened. And clonazepam, also known as Klonopin. So I will read those three again. So on November 25th, 2022, Nurse Paul prescribed Lindsay three different medications: Ambien, Remeron, and Klonopin. Okay. Lindsay reported to Nurse Paul that she was continuing to struggle with sleep, still feels disoriented, forgetful, not connected with her body. She wakes up, she is feeling hungover. She's on heavy medications. And that she was scared that she was becoming addicted to benzos. She feels like she's in a panic state right now. The next day, November 29th, 2022, Lindsay began working with Nurse Paul's colleague, Nurse Jollotta. Jollotta, that's how I say it. A certified nurse practitioner, once again with South Shore Health Perinatal Behavioral Health Program. That day, Lindsay told Nurse Jollotta that she was getting physically dependent on benzos in order to sleep. She further reported feeling completely overwhelmed. Her mind is constantly running. She reported feeling afraid, as if something awful was going to happen in the next several days. On November 30th. So I wonder if that was an inpatient stay. So it wasn't clear in this record if the South Shore, if that behavioral health program, if that was inpatient or not. Because November 16th is when she goes to the emergency room. And then November 20th is when Patrick, her husband's mother, reaches out to South Shore Health. Let me Google South Shore Health. That's what we're here for. Massachusetts. And their perinatal program. Let's see, Women's Health, their perinatal behavioral health program. Okay, so it might have been a day treatment program. So they didn't clarify that in this lawsuit. They didn't clarify what exactly it was. I have sometimes referred clients to day programs. So a day program is where you go to the program during the day and you come home at night. So you sleep at home at night and you go to the program during the day, often getting medication changes, getting therapy, getting support for your mental health during the day, and you go home at night. It does look like they have a behavioral health program, because this was the specific one listed in the lawsuit. And okay, so it's a program. They can walk into the clinic. These are the hours, conditions that they treat, and then the team. Okay. So I was just confused about what type of program it was. Let me see. Yes, Klonopin is a benzodiazepine. Okay. And then let's see what Ambien. Ambien is not a benzo, but it can be habit forming. It's a GABA. Works on the same GABA. But it does a similar thing, but it's not a benzo. So, all right. Question. I've never been tested. Ooh. So, for psychological testing, I would reach out to a psychologist that does psychological testing. And psychological testing is a great place to start to if a person has some concerns. You can talk if you have an outpatient therapist, you can see if they have any recommendations. These are general things. I can't help people one-on-one. Okay. I can't help people one-on-one. So that is my general thing. If you are getting testing for bipolar disorder, you might ask, like, if I'm concerned about potential mood disorder, do you test for that? That would be a question to ask. If there are any other concerns, like potential undiagnosed autism or ADHD or anything like that, you might just ask if the person tests for those things as well. Okay, just general things. All right. So, all right. Once again, all right. So we are at that she was prescribed all of those things. Okay. All right. Okay. On November 3rd, Nurse Jollotta prescribed Lindsay Seroquel for the first time. Seroquel, I believe, is in the antipsychotic family. Seroquel. Yes, an atypical antipsychotic can be used to treat schizophrenia, bipolar disorder, and major depression. It can make people sleepy. I would wonder if any of those medications were taken off. All right, so I don't know if any of those medications were taken off. I am reading the lawsuit. Lindsay quickly reported the negative impact of this medication on her mental health. And she told a coworker whom she had began receiving therapy, an that she had an addiction to Ativan, and that's why she can't sleep. She reported weight loss, lack of appetite, panic attacks, and feeling numb. And for the first time, so this is sometime in late November. For the first time, she reported having thoughts to harm herself. On or about December 5th, 2022, Lindsay reported to this new provider that she had experienced intrusive thoughts of wanting to die and had contacted Aspire Crisis Support, an emergency service for those at risk of self-harm, over the weekend. Her husband joined the visit with Nurse Paul and reported to her that Lindsay's anxiety had become significantly worse since starting the medications. The following day, Lindsay attended an appointment with Nurse Jollotta. During the appointment, Lindsay reported that she's only sleeping about 3 hours a night, felt completely overwhelmed, mind constantly running. The symptoms presented by Lindsay caused the nurse to ask her if she was having thoughts to harm herself or her children. Lindsay denied having such thoughts, but again said that she was afraid of something bad might happen every day. But she denied having those thoughts. And so, am my just thoughts reading this, because the patient's mental health is continuing to deteriorate, and it looks like they checked in on that. Thank you for the super sticker. I appreciate it. Welcome, welcome. We are reading through Patrick Clancy, Lindsay Clancy's husband, his malpractice lawsuit against his wife's treatment providers that resulted in, well, the allegation, because she's charged with the harm towards her children, and he's alleging malpractice, so wrongful death, and that they overprescribed medication, and that they did not do blood work during this process. Okay. Lindsay also reported believing her ongoing symptoms were more connected to the medication she was being prescribed, and that immediately after beginning a stronger dose of Zoloft, she could not sleep for 48 hours. So SSRIs can trigger mania. So that is something that people have to watch out for. And but normally if a person is manic and not able to sleep, they'll often still have energy and not be distressed about that. It sounds like she was distressed about her inability to sleep, and that's a generic thing. So not every person with mania, but normally when I've assessed people for mania and they've talked about not needing sleep or staying up for 48 hours, they weren't necessarily distressed about it. But in response, Nurse Jollotta prescribed an additional medication known as Valium. These are really strong. It's really okay. And I think because she's concerned about being addicted, and some of the medications she's being prescribed can be habit performing. You can get addicted to some of these medications. Okay. On December 9th, 2022, Patrick called Nurse Jollotta's office and asked for a call back. He made it clear that it was fairly urgent. When Patrick and Lindsay spoke to the nurse, they advised her that Lindsay was still experiencing panic and thoughts of self-harm. The nurse advised Lindsay to continue taking the medication she had been prescribed. Like, Lindsay continued experiencing thoughts of self-harm throughout December. She continued to seek help through Nurse Jollotta, her therapist, and so Nurse Jollotta, another person is her therapist, and in mid-December, the emergency department at Massachusetts General Hospital. During this period, Lindsay reported having persistent thoughts of not wanting to be here. She also reached out to Dr. Tufts, who prescribed her an additional medication known as Lamictal. So Lamictal is a mood stabilizer. So lamotrigine or Lamictal. I have definitely had clients on that one. And that is often used to treat bipolar disorder. Further seeking help on December 20th, 2022, Lindsay admitted herself into a day program. So that's where you go at Women's and Infants Hospital, intended for patients with postpartum depression. While at Women and Infants Hospital, Lindsay reported that she started having passive thoughts of not wanting to be here, immediately starting the Seroquel, prescribed in November 30th of 2022. So less than a month later. And passive thoughts like that, like it's not like it's not a plan. It's not active. I want to not be here. It's more just like, if it's just more just like a general vague thoughts. And so, and the day program is where, once again, you go during the day and you get to go home at night. At Women's and Infants Hospital, Lindsay reported, among other things, heart palpitations, severe depression, feeling numb, that her life is becoming a disaster, that she could not feel fear, and that she was worried that she was messed up beyond repair. She also reported a general inability to function. And that's where I would check in. If I knew that she was the caregiver of young children, I would check in on how her ability to care for herself and her children. All right. Women and Infants Hospital determined that Lindsay's mental health issues were likely due to overmedication and misdiagnosis, and that its day program was therefore not appropriate for her. What? They refused to accept her? I wasn't expecting that part. So the day program refused to accept her because I've never had that happen. Like, day programs are the best fit for somebody that I think it would be in this exact situation. And they could monitor on a daily basis to take her off of the medication that she has too much of and to help clarify things. That's what I would think. But I'm surprised that according to this, I don't know what's true. According to this, they reached out to Nurse Jollotta to discuss Lindsay's care. According to this, the nurse failed to respond to them, according to this. Lindsay's condition continued to deteriorate, and on January 1st, 2023, Lindsay admitted herself to McLean Hospital as a result of thoughts of self-unaliving. She remained at McLean until January 5th, 2023. I would want to know if they took off any medications, if they added any medications, what was done during that inpatient stay. Lindsay returned to treatment with Dr. Tufts the following day on January 6, 2023. She was diagnosed with chronic major depressive disorder, single episode, moderate. I probably say severe, but they said moderate. She recorded that Lindsay's psychiatric condition was deteriorating and that her medication was not effective. Okay. Despite her poor condition, Dr. Tufts met with Lindsay for only 17 minutes. A 17-minute med check can be quite common. Dr. Tufts met with Lindsay for another 17 minutes 3 days later. But that's about how often a med check is, though. This is a lot. So, and they aren't being clear of what medications were taken off. So I'm thinking some of these medications have been taken off. They're not being clear. I'm just reading this. I would think something would be taken off. I would, because if I was the therapist, I would be, if a client comes in, because you shouldn't be taking Valium and you should be taking Trazodone and Ambien, because something has to stop between the Trazodone and the Ambien. You wouldn't be taking Klonopin and Valium. So I'm hoping some of these medications were taken off, but this has not made it clear. But this is the husband's side. And I don't know if the hospital's response will be public or not. So I don't know if there's like a formal something filed. I don't know if it'll be public. If it is, I will definitely go through it and we'll talk about it again, because I think the hospital is going to have a very different view of all of this. And they might clarify some, if any of this isn't clear, because I would want to know when medications were discontinued, when medications were started, what recommendations were made. I would definitely have some additional questions. On or about January 12th, 2023, Lindsay reported to Dr. Tufts that she was still feeling a very low mood, no motivation, and just very depressed. This has been ongoing for months now, and I'm getting desperate for something that would work quickly to get me out of this depressed state. 4 days later, during another 17-minute visit on January 16th, 2023, Dr. Tufts reported Lindsay's mood to be depressed, her affect depressed and flat, writing that Lindsay's mood is very low, no motivation, and numb, able to force herself out of bed, take care of basics like eating, concentration is fine, care for baby bonding feels forced, and no suicidal ideation. And so because Patrick and Lindsay's side likely have all the medical records. And so some of these quotes are likely taken out of the medical record. Lindsay had a final appointment with Dr. Tufts on January 23rd, 2023. During that 17-minute appointment, Lindsay reported that she was a little more anxious, heart racing. She was noticing more morning anxiety. Dr. Tufts recorded that Lindsay's mood was flat and anxious, that Lindsay has no motivation and that she was numb, and that she has to force herself outside of the house. Lindsay's sleep and medication efficacy were poor, her insight was poor, and her psychiatric condition generally was unchanged. The date of the incident was January 24th, 2023. So she met with her psychiatrist on January 23rd, and the incident occurred on January 24th. So trigger warning for harming the children. Lindsay has been accused of harming the 3 children while Patrick was briefly out of the home on the evening of January 24th, 2023. The children, 2 of the children died the same day, and the 3rd child succumbed to their injuries on January 27th, 2023. According to medical records, Lindsay did so because she started hearing a compelling and unrecognizable singular male voice that told her this is your last chance and that she has to take them with her. She also reported that voice indicated to her that she should die and this was her last chance and that her children would suffer if she was gone, like only her if she was gone. Lindsay then, so the trigger warning for self-harm. And so she harmed her neck and her wrist. And I pointed to them backwards, wrist and her neck, and jumped out of a second floor window of her home. She fell approximately 20 feet to the ground and suffered traumatic spinal cord injuries. She is now paralyzed below the sternum. And so their allegation is that Dr. Tufts and Nurse Jollotta's treatment of Lindsay fell below the standard of care, that they were aware of her thoughts of harming herself, and their allegation is that they did not take reasonable steps to treat her. The standard of care required that they take reasonable steps to appreciate the full extent of her psychiatric condition and provide adequate treatment to her. And the word is adequate, and that's where it'll be interesting to see where this goes. I don't know. They both met with her via video conference rather than assessing her in person, but I wonder if that worked better for her schedule. Like, I wonder if she was the one that requested, and there have been times. So if I have a client that is that is experiencing significant issues, I will say we have to meet in person. um and so the psychiatrist's job is to prescribe medication. That is the psychiatrist's job. She also had outpatient therapy. They didn't talk a lot about the outpatient therapy part, but okay. And so I think they're saying doing so provided them with an incomplete picture of her condition, as they did not have the ability to fully assess her body language. Moreover, the visits were too short, but a 15-minute med check is common. I mean, I'm just being honest. A 15 to 20-minute med check is pretty common. I'm guessing they would have wanted like a 30-minute. I don't know. Because normally it's like, okay, what are your symptoms? Okay, here's your script. Like normally you're not getting, but that's the state of our modern psychiatry. But I'm just reading. I'm reading the lawsuit. Okay. Indeed, in the weeks before January 24th, so they were meeting with her more regularly than they would a client that was stable. So what can be common for a client that is stable, you might meet once a month for medication checks. You might meet every 2 months. You might meet every 3 months. They met with her, I think, 3 or 4 times after that hospitalization. They were meeting with her every like 2 to 4 days. And so they were increasing the frequency of her visits. I would also like to see in the note, were they assessing her for any voices? It doesn't sound like she reported to them that she was hearing anything. But it would be interesting to see if that was assessed at all. And I don't know if this goes to a jury. I don't think malpractice cases, I don't know if they go to a jury. Malpractice, maybe they do. Malpractice, medical, do they go to jury? Because if it goes to a jury, okay, so they do. So some can. Some malpractice claims can be, but there's often a low trial rate, but they can go to a jury. Because she was also a nurse. So I don't know if a juror would expect her to also kind of say, I'm hearing a voice. Because I don't think her husband knew that she was hearing voices either. I don't know. Because that voice thing seemed to come out of nowhere. that had never been reported anywhere else in this claim. And I also don't know what recommendation they made to Patrick. So if I knew my client that was taking care of children was extremely like they're having thoughts of harming themselves, they're having thoughts of harming their children, I would want the other like I would want to make sure that they weren't having unsupervised contact with children. For anxiety, talk therapy can often be better because with anxiety wants certainty and control. And I have a prior video talking about severe anxiety. And sometimes the medications, they take the edge off, but they don't address the underlying issue. Because let's say a person is ruminating about certain things, and some medications can make people feel worse. There's some people that do really well on medications. So I've had people do talk therapy and it's not effective. They go on Zoloft or Prozac or Celexa, and that helps. Where now, instead of meeting every week, we're meeting every 2 weeks or we're meeting once a month. And the medication really does help them. And then I've had other people not do well on medications, and we do have to look at, other things. Thank you, Karen. Malpractice lawsuits in the US are almost exclusively civil actions, specifically considered torts aimed at compensating victims for injury or death caused by healthcare providers' negligence. And all of these people are going to have liability insurance. So they are going to have lawyers to represent their best interest. If you work for a hospital, so if you work in healthcare or if you work in a situation where liability, because if you're a teacher that works at a school, the school's liability insurance is to protect the school. It's not to protect you. So having your own liability insurance, if you need it, is really important. So when I worked for an agency in the past, even though the agency had liability insurance, I had my own liability insurance as well. Marissa, that's super cool. You were on a jury for malpractice. That is super cool. That's super cool. And if a client ever because sometimes what can happen instead of malpractice is there can be an ethics or board complaint against someone's license. And that's a separate process that's overseen by the board of medicine or wherever that person is licensed through. I'm licensed through the board of psychology in Virginia. But this is malpractice. And so has a different jurisdiction. All right. Somebody mentioned breathing exercises helps with anxiety. Yes. And what breath does. So when our bodies get anxious, our breathing naturally gets short and shallow. But taking time to breathe can be helpful. And I told y'all I'm trying out a new app. I know the Calm app has the bilateral listening where you can put two headphones in and the music will go from side to side. And many people consider that to be calming. I'm also trying, I think it's called Inner Flow. Yeah. I like free things and neither one of those are free. And so YouTube also has some really great calming music and things like that. But I likely would have referred for a sleep study. I would have recommended that. We also would have talked practically what are the things that are triggering the anxiety. Because if it's the return to work, and let's say she was still doing night shifts, trying to also manage 3 children, only able to sleep 3 hours. Because I would be wondering, because let's say she's trying to sleep because if she's working night shift, the hours that she might be trying to sleep, maybe the house isn't quiet. I don't know. I would just have additional questions. Yes. So I like the free version of Calm. I like the free version. All right. Let me go back to the lawsuit. All right. I think we're getting close to the end. We'll see. I think there are 30 pages. I might only be halfway through. All right. Let's see. All right. We talked about the time of those appointments. All right. The standard of care also required them to assess and monitor a patient who had unusual, unexpected, unfavorable reaction to medication. Okay. And a simple way to do that is to order blood plasma levels. And that's where I've never had I've never had a psychiatrist order that before. And I've had clients not do well on medications before. I've never had somebody order a blood plasma level. Whether the patient has a slow metabolizer and thus more drastically impacted by medication than she would otherwise be. So I know my husband is very sensitive to medications. I am not. So like I can take a Benadryl and still like drive. But I don't. So I try because like there's it might be for Benadryl because it can make people drowsy, but like he'll take a Benadryl and fall right to sleep. Different people's bodies do metabolize medications differently. But you would be checking in on things like sleep, appetite, weight loss, all of those things. Indeed, the standard of care is to start low and go slow, meaning to begin medication at the minimal level and slowly increase dosage over time. So I've had some clients that start Zoloft where they increase their medication. So like they start on this lowest dose for like a month, or they start on the lowest dose for 3 weeks or 2 weeks. So um and then especially if somebody's having negative effects, you want to pause. You just have to handle it well. Thank you for the super chat. You mentioned that your 15-year-old has major anxiety. May I ask a quick question? Yes. Can So we call it seasonal affective disorder. And so with depression in general, uh, and then with people in general, having less sunlight can affect things. My can affect things. Um, m- Let me. I don't know. My mother-in-law's calling me. Let me text her to see. let me let me text her. They just left the house. They came up for a visit. All right. Yes, seasonal affective disorder is a real thing. And there is something called light therapy. So I have something like a ring light, or they have light boxes because it's about vitamin D. And people with melanin can be more susceptible sometimes. They've done research on this to seasonal changes and like vitamin D and issues. But especially if you live in an area that's not as sunny, because in Virginia, it gets pitch black dark in the winter at like 5:30. It's ridiculous. We're starting to get longer days now, which we're starting to feel a little bit better. There's some people that move to places like Florida, or they move out of the area because they just need more sunlight. Um, Different people talk about how medications impact them. Uh, but I haven't heard of seasons affecting like mania and bipolar disorder. I haven't heard about that as much because normally a manic episode would be about neurotransmitters. Um, but so I have heard of people, so women, their menstrual cycle impacting their moods and impact, because that we call that PMDD. Premenstrual dysphoric disorder is a real thing. And people that can almost get like really strong depression around before or after their menstrual cycle. And so often refer to their gynecologist or to their medical doctor. Um, to take those things. All right. So, and then in the UK, it can be so like cloudy and drowsy anyway. And so I'm glad that they are reminding people about seasonal affective disorder because, um, yes, yeah, I love the UK. Yes. All right. Yep. All right. So let's keep going. All right. Y'all are phenomenal in the chat. Thank you all for being here with me for this. Okay. So instead of going low and slow, the lawsuit claims that The doctor and nurse added and accelerated medications in an ad hoc manner and did not follow the low and go slow principle, radically increasing the risk to Lindsay. And so they're alleging that the inaction and failure to do testing that it fell below the standard of care. And so they go into more things about standard of care. Given her documented deteriorating condition, the standard of care to seek more information regarding her condition, including from those around her, like her family members. And that's where Lindsay was the caregiver for her 3 children, all 5 years of age and younger. Nonetheless, Lindsay reported being unable to function on a daily basis and reported that she was sleeping only a few hours a night, which alone can result in psychosis. That is true. Despite these clear warning signs, Dr. Tufts and Nurse Jollotta failed to reach out to the individuals with whom Lindsay interacted on a daily basis. But it sounds like the husband was aware of her condition. So but that the lawyers are going to add the information. So I understand why that's there. And then they go into the final reason they think it fell below the standard of care. Lindsay's condition was serious and deteriorating. She reported she was feeling afraid something awful would happen, that caring for baby bonding feels forced. And with those statements, they're alleging that the treating staff should have responded differently. Okay. Defendants knew or should have known that she presented a real, clear, and present danger to harm herself and her young children, but that's why she went to the mental health hospital. That's why I don't know who recommended going to the day treatment program, but she was denied there. And I don't know if the not getting back to that provider was just forgetting to return a phone call, because I have done that before. I don't know what happened with that, but okay. Ooh, count 1, wrongful death. Plaintiff repeats and realleges the allegations contained above as if fully set forth herein. Patrick Clancy, as personal representative of the estates of his 3 children, for the negligence of defendants in causing the deaths of Cora, Dawson, and Callan, the 3 children. All defendants owed Lindsay, Cora, Dawson, and Callan duty to exercise reasonable skill and attention in their care and treatment of Lindsay. Defendants failed to exercise reasonable skill and attention in caring for her. Defendants' conduct deviated from acceptable standards of medical practice. So that's where they're alleging, instead of going low and slow, that and I don't know what dose she was starting those different medications at. You typically would start at the lowest dose, particularly like if somebody had a negative reactions. As a result and proximate result of negligence, defendants Cora, Dawson, and Callan are deceased. Further, the actions and omissions of defendants also constituted gross negligence and reckless indifference to the health, safety, and welfare of Lindsay and her children, and showed reckless disregard for the consequences which defendants knew or should have known could result from their actions or omissions. So there have been cases that I've seen virtually where it got to a point where I was like, you need to be seen in person. And I've recommended, because the person did not live close enough for me to be able to meet with them on a regular basis, or like the level of concern for their active mental health, telehealth was not the best fit. And I required in-person sessions, or like maybe the person lived in another part of the state, and I provided recommendations and referrals for other providers where they could be seen in person. That is something that I have done in my own practice. These children are survived by their father, who has suffered damages as a result of their death, including without limitation services, protection, care, assistance, society, companionship, comfort, guidance, counsel, advice, and consortium. Patrick has also incurred funeral and burial expenses, as well as and other damages as a result of Cora, Dawson, and Callan's deaths. As a result, the foregoing Patrick and his heirs are entitled to recover damages and punitive damages from defendants in the amount to be determined at trial. I thought they asked for 1 million. I don't know, but they're just leaving that to the amount determined at trial. So then there's a count two. The count two plaintiff, which is Patrick, repeats and realleges all the previous allegations as a direct and proximate result of their negligence, recklessness, and gross negligence. Defendants caused Cora, Dawson, and Callan to endure horrific conscious pain and suffering. Okay. And then count three, violations of the health insurance HIPAA. Violations of HIPAA. Okay. Plaintiff Patrick repeats and alleges everything else. On January 15th, 2026, South Shore Health disclosed to plaintiff that on November 17th, 2025, it had discovered that a South Shore Health employee had inappropriately accessed Patrick, Cora, Dawson, and Callan's medical records. Okay. So I guess an employee that was not assigned to their care had accessed their medical records. South Shore Health's employees' inappropriate access of those records and children's records amounts to a violation of HIPAA, and it would. And probably that person would probably just be fired. I don't know that there would be huge damages with that because it was a high profile case. Maybe, I don't know. But but that's a part of this claim, a HIPAA violation. Okay. So the plaintiff demands a trial by jury. That's how, and it has some other legal words, but that is the gist of it. Whew, we got through it. Welcome. Once again, I'm Dr. Barry. I'm a licensed clinical psychologist. I am not a medication expert. So anything talked about, but I do take psychopharmacology to be able to have a general idea about medications. When my clients are describing certain symptoms, I can often help them advocate for themselves with their treatment team. I will sometimes write a letter and provide it to my client to give to their psychiatrist, or I will fax it. I'll get permission, if the client agrees, to send it directly to the psychiatrist listing my concerns. I've done that multiple times. Especially if my client keeps saying, I keep mentioning these concerns, and there are no changes being made, things continue to remain the same, and I continue to feel the same way. I will often help document whatever concerns I'm observing, the things the client is reporting, and kind of help things move forward. In general, this lawsuit, my heart breaks for that family. So Patrick Clancy and his mother are very supportive of her. It does sound like Lindsay Clancy was attempting to get help. One of the other, so I wonder if Melanie Little read Lindsay Clancy's lawsuit, because there was another version where I heard that her described as this like strong person that like was doing all of these things and put everybody else's needs first. I'm paraphrasing. That wasn't exactly how it was stated. But when I heard that description, I was like, oh, is that a person that might struggle to fully communicate how they're really doing? And it does sound like she was reaching out for help and support. I would want more information on what medications were stopped, because the way they wrote it out was confusing to me, because I'm thinking some of those medications had to be discontinued at some point, and the way it's written, it was not clear when medications were stopped. It did list the dosages for some of, and I skimmed over some of the dosaging information. If you do want to find this for yourself, I found it on Scribd, so SCRIBD. If you type in Patrick Clancy malpractice lawsuit PDF, this will be one of the things that pops right up. So that's where I found this information. It was filed on January 20th of 2026. And so, yes. And so she did check herself into the hospital more than once. She went to the ER. She went, because remember, I think it was in November, she was having trouble sleeping and she went to the ER. And I think the ER gave her like one of those medications. So, and then she was at another mental health hospital in January for, I think, 5 days. So, um, and please know, so not guilty by reason of insanity does not mean that the person does not have a mental health condition. What it means is at the time of the crime, they did not realize that what they were doing was wrong. And some concerns I have with this case is that she sent her husband away. So my understanding, okay, we haven't seen all the details of this. It sounds like this was intentionally done when her husband was away and couldn't intervene. And if you're hearing a voice telling you, you have to do this, so there will probably be a mental health expert. They probably have multiple mental health experts that will say she strongly believed that this voice was accurate, that she could not, that she was having these thoughts to harm herself, and that she could not appreciate the wrongfulness of her actions. But my question would be, but wait a minute, why did you wait until he was gone? I would have some additional questions. Now, do I think she would benefit from mental health treatment? Yes. I don't think Massachusetts is one of those states that have the guilty but mentally ill. So if she was in Nevada, Nevada has the guilty but mentally ill, where the person can get mental health treatment. She's also paralyzed from the waist down. And so, like, incarceration is not going to be an easy thing. But I don't think the state is dropping their charges against her. Yeah, yeah. And so I think this is maybe what she's reported after her arrest. Because remember, I think she was unconscious for a period of time. And so I do believe she's pled not guilty by reason of insanity. And he might know, like, he might have access to the mental health assessments that have been done post arrest. That's my guess. I don't know that for sure. Sofa speculation. Okay. As Paul would say over on Reporting Live from my sofa. All right. Let me know if you all have any other general questions about this one. I am starting to wrap up. I do think on Tuesday, I'm going to talk about mental health and diet because RFK Jr. has some thoughts about curing schizophrenia and bipolar disorder through diet. And I need a whole video just to talk about that. So I think I'm gonna do that on Tuesday at 6 p.m. And that'll give us another little break from a heavy case. And then I think we'll start diving into, I think Corey's case will be coming up soon. Corey Richardson. Her case will be coming up really soon. I did see that the woman that got pregnant through the wall in jail, Kathy from Gossip Rumor and Innuendo, had her sister on. Let me find her name. Let me go to Kathy's page. Kathy did a post about it. Gosh, Daisy Link. Daisy Link is being given a new trial. Yes. So Daisy Link, her sister was Crystal. So Daisy Link has been given a new trial. Her conviction was overturned because they felt the jury was prejudiced by her pictures. So they showed pictures of her. And so if that one goes back to trial and if she testifies, because I really didn't talk about this one here, she claimed self-defense, I think. I want to say she said self-defense because there was a history of DV. And so if that one goes back to trial, which I think it will, I don't know if the state will try to do a plea agreement. I don't know if she'll take a plea agreement because I think she wants a not guilty. I think she's fighting it. I think she wants a not guilty. Now, so I have heard some people say that, yes, changing their diet helped there be a remission in symptoms where the symptoms went away for a period of time. But just I haven't heard somebody say that with the diet change that their symptoms never ever came back. Because there is a woman here on YouTube that talks about changing her diet to manage her schizophrenia. I think it's living with schizophrenia. And she made those diet changes and it worked for her for about, I think like for maybe 10, it worked for her for a while. And then some of her symptoms started to come back and she's had to make some adjustments. And so I definitely think diet can be an impact, but I just I th- I like I like to give you all the information. And so the pictures were not admitted, but I think they were still shown to the jury. And so the judge whoever overturned it, they said that was enough to prejudice the jury. So I think the pictures were displayed to the jury. They were not entered as evidence, but they were still shown to the jury. And they ruled that those pictures prejudiced the jury. So she's going to get a whole new trial. Yes. So there was there was another inmate that was on the other side of the wall. And it's my understanding that I think in a condom, I want to say it was in a condom. So he had happy thoughts and placed his swimmers, I think, in like a condom or tampon or something. Like I think a condom or something. And then she inserted it and she got pregnant in jail and has a baby. Like there was a whole baby. She got pregnant in jail. Like that's a real thing. I think he's a convicted murderer. I believe he is. It's like a whole thing. Kathy has a video on it. If you want to go back, just Daisy Link. It's probably one of her first videos talking about Daisy. Kathy talks about it in a hilarious way. Keto can be really important. Diet is very important. And it can be very beneficial. It is troubling when somebody says one thing can cure everything. And that's just not how mental health works. And so that's why we're here just to talk about things in general. And so I like to do that here. Take care of yourself. Be kind and don't do crimes. And I will see you next time. Have a good one. Bye.